Good morning, everyone. Thank you so much for joining us today at our second Partnership Coalition meeting. We are delighted to have you here. For those of you who are joining us for the first time, welcome. We're very happy that you're joining us. And for those of you who are returning for a second time, we're glad you're back to join us again. So just to kind of quickly recap about our last meeting, for those of you who weren't able to join us, we actually introduced the vital conditions, and we started talking and discussing 3 of the vital conditions, which is a conversation and discussion that we're going to continue today. Also, during our last meeting, we talked about the mission and the vision for the coalition, and we're going to continue that discussion as well as we start to work together as a team to solidify and finalize what our mission and vision are going to be. So, next slide, please. I quickly wanted to walk you all through the agenda. So today is our welcome. I'm Dr. Cuffey, and I wanted to welcome you this morning. Next, we'll have our state health improvement process, mission, and vision, and that discussion will be led by Noelle Duckworth. We'll have a state health assessment update, and with our state health assessment, we'll let you know where we're at. We'll share some of our findings and some interesting things that you might be interested in learning a little bit more about the state health assessment. We'll have a short break for about 5 minutes, and then we'll launch into the continuation of our discussion about the vital conditions. And then we'll introduce you to the World Cafe process, which we'll be using for that discussion. And we'll close the meeting by talking about our next steps, our next meeting, and then we'll adjourn for the day. Before we launch into our objectives, I just wanted to give you just a couple of quick updates about technology. We are going to be keeping our microphones muted until we enter our breakout rooms during the World Cafe exercise. At that point, we'll be able to have a more rigorous discussion. At that point, you'll have opportunities to share your input. We'll also be polling you during the mission and vision so that you can actually vote on which of the mission and vision statements you actually prefer. In the meantime, if you have any questions or you want to add your thoughts to discussion, please feel free to use the chat function, and we'll be monitoring that at all times. And if you're welcome, please feel free to keep your web camera on throughout the meeting. But if not, we completely understand that as well. So, our objectives. So just a recap and a refresher, the SHA and the SHIP process is intended to be a collaboratively developed process to increase the alignment and investment in the implementation of the work to improve health, well-being, and equity for all people in Delaware. And now I'll turn it over to Noelle, where we can start to talk about our mission and vision, the discussion we started earlier during our last meeting, and select which mission and vision we're going to move forward with. Noelle.
Thank you, Dr. Cuffey, and good morning, everyone. I'm Noelle Duckworth with the Partnership for Healthy Communities here at the University of Delaware. And for those of you that joined us in our first meeting of this coalition in December, we spent a fair amount of time doing a brainstorming session using Jamboard, which is pictured here to the right with a lot of virtual sticky notes. And spent time asking all of you for input on language around the mission and vision statement of this coalition of stakeholders across Delaware, who are really engaged and critical voices for improving Delaware's health and well-being. And so we spent some time after that call kind of going through all of your feedback. And what we'd like to do is start to narrow down the mission and vision statements for the work of this group. Again, this group has meetings scheduled till the end of the fiscal year. So that would be through the end of June. And we hope to continue the process into drafting a state health improvement plan beyond that. That is something that certainly Delaware Division of Public Health aims to do as part of this work. So, so the mission and visions are important as we frame our work and to help guide us in both a collaborative assessment as well as a robust and comprehensive state health improvement plan for the next 5 years. So the mission option number 1 on your screen there, I'm going to read it now. And if you, as I read the 2 options for the mission, if you have a piece of paper handy where you can select what option of the 2 missions you speaks to you more and is preferred, because we're going to launch a poll and then ask you to choose that number, option 1 or option 2. So the mission option 1 that we present to you today is to make the state of Delaware a healthier and more equitable place to live, work, learn, and play. Option 2 for the mission is to improve health outcomes, well-being, and health equity across Delaware's communities and population. So what I'd like to do, and then I'm going to read the vision statement as well. We're going to poll on this all at the same time. So if you could also keep your papers out, and I'm just going to give you a minute to reflect on the mission. There's two options. Just take some time to think, which one do you think is more comprehensive and speaks to the needs of the people you serve, the people in your community, your neighbors, the sectors, the work that you're involved in. For the vision statement, we have two options. One is option one, all people in Delaware enjoy healthy lives and healthy communities. For vision option number two, we offer Delaware is a model of health, well-being, and economic vitality. Again, just take a minute to reflect on those two vision statements and visions, and think about which one you think encompasses the vision that you see for the state, and also if the mission were to be achieved, what that if that vision captures that. Okay, so without further ado, I'm going to launch a poll here. And if you need to see the slide, you might want to grab that poll and move it off to that window and move it off to your right or left. So you can, if you're still deciding. I'll just give folks a few minutes, if you will, to vote on those two questions. Which mission statement option do you prefer, number one or number two? And which vision statement option do you prefer, option number one or option number two? And please don't put it in the chat. Please go directly to the poll and vote there, please. Okay. Folks are still voting. Okay, it looks like 100% have answered both. And the envelope, please. The winner is, for mission statement, it is option number two, to improve health outcomes, well-being, and health equity across Delaware's communities and population. And the vision statement is option number one, all people in Delaware enjoy healthy lives and healthy communities. Thank you so much for your input on that. I'm going to end the poll, and I'm sharing those results real quick. It looks like both of those were clear winners with a solid majority. So thank you all for participating. Okay, next slide, please. So just a quick review. As you can see, this is a collaborative process. We'd like everyone's input in the work of this coalition that is really charged with collaboratively engaging in a state health assessment for the state of Delaware. Our role at the university through both the Partnership for Healthy Communities and our epidemiology program here in the College of Health Sciences is to really engage in primary data gathering and analysis to present to all of you to further weigh in on. Quantitative and qualitative data is being collected, and our EPI team will share out more about that soon, as well as secondary data analysis occurring, environmental scans, and we have some updates on that today as well. The timeline to complete this process is by June 2023 to issue a state health assessment report. And then we would move into eventually the state health improvement plan that would be guided and informed by that assessment, again in a collaborative process, and it would set priorities for a system-wide response to the public health needs of the state. And again, this is beyond just our public health division and our Delaware Health and Social Services. These are all stakeholder groups working on, invested in, caring about the health and well-being of Delawareans and helping Delaware communities thrive. And the plan is to describe how we all work together to improve the health of Delaware This does inform, of course, the Delaware Division of Public Health Strategic Plan, and it also supports their continued reaccreditation as a state health department. And we all, I hope, can agree that having a robust and well-supported, well-invested and accredited health department is critical to improving health and well-being in Delaware. And the timeline is then to produce a new 5-year plan, SHIP plan during fiscal year 2024. Okay, next slide, please. And I'm going to turn it over again to our EPI team, who's going to talk more in depth about that data collection underway.
Hi, so we completed door-to-door surveying in both Newcastle and Kent County. We used a CDC methodology called CASPR, and it was completed in October and November of 2022. We have a final survey going out. We'll be doing door-to-door surveying, and it's scheduled for February 16th through the 18th in Sussex County. We're also we'll be doing some qualitative research. So we're calling those community conversations. And we are actively recruiting with our partners 10 to 15 participants to have more in-depth conversations about the vital conditions. So we have one scheduled for March 8th with Bellevue Community Center. And then we have one tentatively scheduled with community partners in Kent County, but we're still actively seeking someone to partnership in Sussex County. If you're interested in partnering with us, please email us at info@delawareship.org. We have opportunities to participate in the primary data collection, and we're also asking that you give us any reports or secondary data collection that you would like included in the state health assessments, and any groups that you think that we need to invite to the table. Next slide. As part of our work, we did secondary data analysis. So we looked into available data sets, such as Delaware Statistics, America's Health Rankings, and Behavioral Risk Factors Surveillance Systems, BRFIS. We also looked at 6 different hospital systems for their community health needs assessments, and about 15 community organizations, community plans, to see what other organizations are looking at in terms of priority public health issues, any key indicators that they have for those vital conditions, and overlapping priority public health issues begin to emerge. I'm now going to pass it to Braulio.
Hello. So yes, to start, I wanted to highlight the image to the right. Shows a pie chart from a Kent community health needs assessment. It looks at both health outcomes and vital conditions. The top 3 health issues that were identified include depression or mental health problems, 51.58, overweight/obesity at 48.42, and COVID-19 at 42.11. For the hospitals that we looked at, out of the 6 community health needs assessment, included BB Health, Bay Health, Christiana Care, Nemours, Tidal Health, and Trinity Health. So some of the items we wanted to highlight were 4 out of 6 community health needs assessments stated that behavioral health and mental health were a priority. 4 out of 6 community health needs assessment also stated that access to nutritious foods such food security were a top priority. In a study in 2022, nearly 1 in 4 people, so 22%, survey participant reported having to cut the size of meals because there was not enough money in the budget to buy food. So that was from Nemours 2022. Next slide. Also wanted to highlight this quote from the Christiana Care Community Health Needs Assessment that said a lack of affordable, safe housing is noted as a significant community health issue. Rent has escalated and there is a lack of group homes and apartments housing, which has precipitated homelessness in the community. Interviewees noted that the lack of safe housing affected the ability to discharge patients from inpatient care in a timely manner. There was also a reported issue with landlords being unwilling or reluctant to serve those with known mental illness. So for the organizations and plans, we found that public safety was found to be a priority issue for 3 out of 15 organizations that we looked at. And some of the interventions that they suggested included crime prevention, alternative activities for youth, and neighborhood watch groups. 5 out of 15 organizations also found affordable housing to be an issue. And some interventions for that included rent control, of building affordable housing, and making some homeownership a priority in low-income neighborhoods. So for the 3 out of the 15 organizations that found public safety as a priority issue, they recommended, for the 6 out of 15 organizations that highlighted education as a priority, some interventions that were recommended included increasing opportunity, access, and skill development, as well as adding one of the organizations is actually looking to add a new resource center. So 10 out of 15 organizations found healthcare and outcomes to be a priority, and found some proposed interventions to be mental health and substance use support, health education, and finding new ways to reinforce healthy behavior as some interventions that they could do. Now we're going to be handing it over to Kate for the vital conditions for health and well-being frameworks.
Reminder, we are using the vital conditions for health and well-being as a framework for the state health assessment and the state health improvement plan. And that's because we're taking this opportunity to focus less on each individual health outcome or disease condition and think more about all of these upstream factors that impact many, many disease states and what we can do to prevent disease and improve health before people become ill. So if we're thinking about that, we really need to think about our communities in which we live, learn, work, and play, and the influence that those neighborhoods have on our health. So if we think about this, what makes a healthy, safe, and vibrant community of opportunity, that's where this well-being, health and well-being conditions framework comes in. So you'll see each of the vital conditions listed on the right. These are the things that all people need all the time to thrive and reach our full potential. So the last time we came together in December, for those of you who participated, we began asking about your input on the status of the vital conditions for health and well-being in Delaware. We talked about, for each vital condition, who has access and who might not have access, challenges and barriers to advancing that vital condition for all, and what assets and resources we might have in the state to improve that specific vital condition. So in the December meeting, we covered basic needs for health and safety, belonging and civic muscle, and humane housing. And in today's meeting, we're going to cover reliable transportation, lifelong learning, meaningful work and wealth, and the thriving natural world. So by the end of today, we will have gathered a lot of your input on all of those vital conditions to contribute to the state health assessment. And we'll be talking about that and give you an opportunity to do that in breakouts in just a few minutes.
As you refocus your attention to the meeting and the slides that we're sharing, I see some questions in the chat, and I also see that folks have already been emailing info@Delaware SHIP about interest in partnering on Sussex County community conversations and additional data gathering. So thank you so much. We'll follow up with you all shortly. And yes, today's slides and information will be posted on the DelawareShip.org website. There's a new tab under there that says SHIP Coalition. And that will be posted after this meeting, and the entire meeting recording will go up in several few days to follow. It takes a little while to get that edited and up in the UD's YouTube link that we can put that up on the Delaware SHIP website. But the slides will be up there fairly shortly following the meeting, and we'll follow up as well with all of you to let you know that. So again, I'm Noelle with the Partnership for Healthy Communities. And for those of you that joined us in December, as Kate mentioned, we started a virtual introduction to the World Cafe, a virtual rendition. A lot of folks have taken this exercise that's typically done in person at round tables or moving from room to room and turned it into virtual post COVID and all of our Zooming lives since then. And so what this does is the World Cafe, it allows us to really hear from all of you, your insights and your experiences and the work that you're doing, and bring that to these topics and these important vital conditions that we hope to assess and better understand the assets and the needs across Delaware geographically in different communities and populations, etc. So it'll set the context and share the guidelines in just a moment. Each round is guided by questions, and we will have facilitators in your room to walk you through that. And we're actually going to have, we did 3 rounds the last time. I apologize, we didn't update that slide. We're going to do 4 rounds this time. And at the end of each round, facilitators will move to new rooms. So in a few minutes, we'll be putting you into a breakout room. You will stay in that breakout room for the next hour. But every 15 minutes, you will have a new facilitator that will talk to you about a new vital condition and ask you to weigh in on that. And we ask you to share invites and conversations with each other. So you get to stay virtually seated, and it's our facilitators that have to pick up, take their notes, and move around. The World Cafe guidelines really, again, are just to focus on what matters most to the people you serve, people in your community, yourself, your neighbors, your loved ones. Listen, really seek to listen, to understand. We have a lot of diversity in this room. We have folks that are fairly new to the SHIP process and to community health needs assessments. And we also have seasoned folks that have been doing and participating in health needs assessments for quite some time. And so we really have a lot of great perspectives and different sectors represented, since these vital conditions do span so many topics and issues, because health outcomes are influenced by them. Connect ideas. I'm sorry, could you back up for just a moment, please? Contribute your thinking and experience, and really listen together for patterns and insights and deeper connections. So please don't have imposter syndrome, because you're all going to be, you all have expertise in different areas, and you're going to be talking and adding into adding your thoughts and input and lived experiences to each of these vital conditions, whether it's the thriving natural world and built environment, and reliable transportation, meaningful work and wealth, and lifelong learning and education. So share, and I'm sure there'll be some rooms where you feel a little bit more comfortable because it's in your wheelhouse more, but please do share. We do want a diversity in thought of an experience and perspective. So, okay. So without further ado, we're going to go ahead, and I am going to send you all into your rooms, and our facilitators and note takers with our students will be helping take notes, and some of our team. So just give them a moment once you all arrive in there to set up shop and share their screens, and they'll tell you what topic you're starting with. All right, everyone, I think everyone's back into the main room, or should be, and I just want to thank all of our facilitators and note takers. I know that was hard to wrap up discussions and quickly, and then be just whisked out of your rooms and moved into another one. It reminded me of my son when he plays video games and says he spawns into a new biome all of a sudden. So So thank you for moving through that rapidly, and to all of our participants for your patience as facilitators kind of left unexpectedly in the middle of your comments, and you received new facilitators and they needed to share their screen and introduce their topic. I will say I got a chance to listen into some of the different room discussions, and it's just amazing how each group added on to previous discussions in a really progressive and comprehensive way. So we really have rich data to work with. You all. Every group had lots of healthy discussion, and I heard a lot of shared spaces and voices. So thank you all for giving each other time to share your perspective and making space for all folks to be able to participate. That concludes our World Cafe now. And so in just our final minutes, I'm going to turn it over to Dr. Yandele Kofi, who will talk about our next steps. And just to share one more time that, yes, the slides will be posted very soon, and other meeting materials in delawareship.org. And as I turn it over to Yanda, I'll write that into the chat. Thank you all.
Thank you so much, Noelle, and thank you again, everyone. Thank you so much for being here today. To echo what Noelle said, our sessions during World Cafe were really incredible. We gained a wealth of knowledge and had some really wonderful and engaging conversations with you, and it really spoke to the collaborative aspect of the ship that we're working on, to hear all of these different voices and expertise. And we'll be working hard and diligently to pull all of this information together. So I think we made a lot of progress today. We went through 4 more vital conditions. We solidified our mission and our vision. And I think we are ready to move on to our next meeting, which will be held in April 6, 2023, same time, 11 a.m. to 1 p.m. And we'll do this again on Zoom. Again, thank you all so much for prioritizing this meeting, for being a part of our journey with the Delaware ship. We really appreciate you, and thank you for your time today.
Thank you.
Thank you.